Hello, everyone, and welcome back to the Stellar Cycles podcast, your hot girl database for all things pertaining to your femininity, your cycle and wellness, and your walk in life as a woman. I am your host, Alina, and today we're talking about all things endometriosis. This is part 2 of our Common Female Diseases and Disorders series, where we're going to talk about very common reproductive conditions that affect women that honestly have kind of become a bit of a buzzword and like clickbait, especially in the online space. My goal is to help you understand what endometriosis is, how it originates, what it looks like, and how it is treated. This is, like I said, another one of those really popular female health buzzwords, but without a proper understanding of the disorder, it can be quite a confusing term. My hope for this episode is to give more awareness to endometriosis and the struggles it brings, from extremely painful periods to painful intercourse and often the fertility issues that it can bring as well. There is hope because modern advances are procuring more ways for us to deal with and eradicate this very common female reproductive disease. As always, don't forget that this information is purely from my standpoint, being an ultrasound tech who has worked with many women and seen quite a few of these cases in the clinical setting. And I'm just interested with sharing its characteristics with my listeners. All of the research done and experience that I've had has been according to my viewpoint, so always check with your healthcare practitioner if you are experiencing endometriosis yourself or think you might be. So let's get into today's episode. First off, why do we need to talk about endometriosis today? Well, because of its prevalence. Endo affects about 1 in 10 women. That's about 10% of all women, adding up to about 190 million women globally. The big problem with endometriosis is its delayed diagnosis. It's very often diagnosed 7 to 10 years after women start experiencing its symptoms. Think how much women suffer before they are able to get help. It's also very commonly misdiagnosed because of its similarities to other conditions. So the reason we're talking about endometriosis today is because more awareness will lead to more women advocating for themselves earlier and seeking proper treatment. And as well as being able to manage their symptoms, those symptoms that really impact the woman's quality of life. Another really important part of talking about endometriosis is family planning and fertility preserving options for those people who are concerned whether they're going to be able to have children or not. It'll also give us an idea of how we can access better treatments, and finally, the reduction of stigma. So we can really put a name to the problem and say this is endometriosis. It's not just a bad period. This podcast's number one goal is to normalize these conversations, right? Not only among women, but among our male counterparts, and to also give women awareness that they have options and to make them feel less alone. As I introduce this episode to you guys, my hope is that it's going to empower you to advocate for yourself in the healthcare setting and be able to support others who are going through this. Maybe you have friends, maybe you have family who's experiencing endometriosis. We also want to go back to a holistic understanding, right? So looking at the endometriosis patient as a whole person and realizing that this pelvic condition can also affect other parts of the body, the mind, the soul. Now, just a reminder that even for me, I learned about endometriosis when I was going through ultrasound school. Endo is not something that the average woman gets taught unless she is in the medical field or does her own research upon finding that she has the condition through a diagnosis. Otherwise, we just kind of slap the name bad period on it, and that's all it is. Let's get into the definition. What is endometriosis exactly? The way that endometriosis is defined is it is the presence of functional endometrial glands and stroma-like lesions outside of the uterus. Let's break this down. Endometrial glands are what we call your endometrium. And some of you may know, some of you may not know, but the endometrium is that special tissue that lives inside your uterus, and it builds up inside that uterine cavity to hopefully implant and nourish an embryo when it comes time. So it's a specific type of cells that should only be within the uterus. In this condition of endometriosis, when this endometrial tissue begins to grow outside of the uterus, like on the ovaries or even on the rectum, which is all very close inside the pelvis, is when it starts causing problems. So essentially, endometriosis is a type of cell or tissue that is not where it's supposed to be. Its size and severity can vary from really, really tiny endometrial cell implants where they're not supposed to be to really large cysts and nodules. And this primarily affects young women, with the mean age being 25 to 29. But then again, think about that delayed diagnosis. For many, many years, these women are suffering from endometriosis, but it's not about till they're 25 or 29. They've had a period for several years, if not like 10 or more years, that they finally get a diagnosis. That's literally so disheartening to me. What are the symptoms that people usually present with when it comes to endometriosis? Well, first of all, one could be infertility. About 40% of women that go and seek fertility treatment will also have endometriosis. That's almost half of women who are in treatment for infertility are also struggling with endometriosis. The second symptom is a variety of pelvic pain. That could be pain during sex, pain during periods, which is a cyclical kind of pain. It comes on a cycle. It could be chronic pelvic pain. So it's just pelvic pain at all times, never really goes away, and abdominal pain. There are some less common symptoms that might not be as directly linked, but could also be due to endometriosis. There could be involvement with your gastrointestinal system, like rectal bleeding. You could have a lot of constipation. You could even have diarrhea. You could also be experiencing bladder problems because, yes, those endometrial cells, which are only supposed to be on the inside of your uterus, can also attach to the bladder and cause problems there. That could be things such as bloody urine. It could be urinary urgency or frequency, kind of like UTI symptoms, but it's not a UTI because they can't really link a bacteria to these symptoms. Another thing that's actually really, really scary about endometriosis is that it can present without any symptoms. It can be asymptomatic. So you can have endometriosis and not even know it. That's really, really sneaky. If you suspect you might have this condition, how do you go about getting it diagnosed? Well, diagnosing endometriosis can be really, really challenging, which is why I think a lot of the times it can go misdiagnosed, or women can experience that delayed diagnosis where they don't actually nail down the problem for years because of these variable symptoms. These symptoms that I just listed off could be due to anything, and also sharing symptoms with other disorders such as IBS or pelvic inflammatory disease. When you go to the doctor and you're concerned about your really bad period, right? You don't know yet that it's endometriosis. They're really going to discuss your symptoms with you, all these symptoms that I just listed off. They're also really going to go into your menstrual history. This is a very important one because they really want to know how severe are your periods? How long are they going on for? What are your pain levels that you're experiencing? Is it just that first day of cramps, or is it your entire period? You literally have to call out of work. You can't get out of bed. You can't do anything else in your life. Another important one, of course, is family history. If they want to go back and look and see, has anyone else in your family been affected by endometriosis that you know of? They might also do a pelvic exam on you where they kind of go in with their fingers and feel around your pelvic organs like your uterus and your ovaries, but this is not very dependable unless those cysts and nodules from endometriosis are already large and able to be felt by hand. Because remember, some of them can be super tiny but still cause a lot of problems. Of course, we have imaging, medical imaging. That's where I come into the picture. First one being ultrasound. Ultrasound can help detect endometriosis unless it's those microscopic implants. So one dependable way that we see endometriosis on ultrasound is ovarian endometriosis. It'll be a type of cyst that we know looks like endometriosis that's growing on the ovaries. And we know it doesn't look like a typical follicle or a typical cyst because with a typical cyst, the fluid, it's very see-through and it's just serous fluid, which is just like a clear kind of fluid, which is what it's supposed to be inside a little follicle. However, with ovarian endometriomas, they're called chocolate cysts because they look like they're filled with blood on ultrasound, essentially. So that's a really interesting one. Sometimes we can also see fluid in the fallopian tubes. That could really impact fertility because your egg can't travel through all that fluid buildup to get to the inside of the uterus to implant. Also, we can see on ultrasound those nodules that are infiltrating the bladder and the endometrial tissue that's growing on the bladder and could be causing those urinary problems. So that's ultrasound. They'll also use MRI, which unfortunately isn't used unless it's more complex cases, like when the endometriosis has gotten really bad and it's now a deep infiltrating endometriosis. It's like really eating into the tissue of your uterus, possibly your colon, your rectum, your bladder. Of course, there is a gold standard, which is what the doctors will usually go for when it comes to diagnosing. The gold standard for endometriosis is what we call a laparoscopy. It's a minimally invasive surgery/procedure where the surgeon will insert a teeny tiny camera inside your pelvis to scan around for any of those little endometrial tissue implants where they should not be. And if they find anything that looks suspicious, they're going to cut some of that tissue out, just a very, very small amount, and then biopsies it. So they'll run it through the lab and test those cells to confirm that that's exactly what shouldn't be there. They will also try to exclude any other diseases, like I said, such as IBS or pelvic inflammatory disorder, because they could share a lot of the symptoms. So they really want to make sure it's not those before they go ahead and diagnose you with endometriosis. As we go into the future and as advances get a little more sophisticated and more studied and more researched, they're really working on getting more non-invasive tests like blood and checking for other biomarkers to really help diagnose for endometriosis. What kind of risk factors would predispose a woman to getting endometriosis? First, being genetics. So if you have a family history of any women in your family having had endometriosis themselves, your chances jump up to 6 to 10 times of also getting the condition yourself. Also, there's genetic variations or mutations that you just simply can't control that you might be born with that could predispose you to getting endometriosis. There's also period factors, things having to do with your menstrual cycle. So, for example, if you start your period at a very early age, that could make you more prone to getting endometriosis. If you have heavy or prolonged period, like a lot of bleeding and for more than 7 days, that could put you at a greater risk too. And as well as shorter cycles. So anything less than a 27-day cycle is also a risk factor for endo. There's also hormonal risk factors. A very big one is going to be estrogen dominance. Endometriosis is dependent on high estrogen levels in order to thrive. Some women are just going to have more estrogen circulating inside their body. That's why we talk about eliminating extra estrogen, because that'll help keep us healthy as women. Another hormonal factor is delayed childbearing. If your body is going through constant periods and never really being interrupted by pregnancy, that could also lead to development of endometriosis. As well as women who have never given birth. If you've never had a child, that could put you at a greater risk for endometriosis. There's also some really interesting anatomical factors. There's something called retrograde menstruation. And no, that has nothing to do with Mercury in retrograde, which is what we're dealing with right now. Retrograde just means backwards. So when you're dealing with retrograde menstruation, that just means your period blood, instead of flowing out of your body, is for some reason flowing back and getting stuck inside your pelvic cavity. And this would make sense, right? Because your period blood is actually the shedding of that endometrial tissue that's supposed to come out of your uterus, that's supposed to kind of renew for the next cycle. If it's not coming out and if it's getting stagnated in your pelvis, I could imagine that all that endometrial tissue could then start looking for other homes on other organs, right? Another anatomical risk factor could be congenital pelvic abnormalities or obstructions. Let's say you're just born with maybe some structures that you shouldn't be born with, or something didn't develop correctly while you were in the womb. That could lead to endometriosis too, and that's just something you can't really do anything about. The immune system has a lot to do with developing endometriosis as well, because when you have a lowered immune system, it's just not as good at recognizing and eliminating those endometrial cells that have maybe migrated or moved outside of the uterus. And inflammation, women with a higher inflammation or chronic inflammation could be more predisposed to endo as well. There are some ethnic variations. Studies have been done to show us that Asian women, unfortunately, are more predisposed to endometriosis, while African American women are least predisposed. Also, lifestyle. We can't ever ignore the fact that there are lifestyle factors that could lead to development of these issues. First one being food. Diets that are very high in red meat, trans fats, and low in fruits and vegetables could be associated with a higher risk. In contrast to that, if you have a diet rich in omega-3 fatty acids and certain vitamins, that could have a protective effect for your uterus and help you stave off endometriosis. And of course, another lifestyle factor that is a risk factor for pretty much any condition is stress. Because stress is going to affect your immune system and your hormonal balance, it can lead to or exacerbate endometriosis. So what about endometriosis treatments and the side effects that they come with? Let's say you have this condition, you're interested in talking with your doctor about what your options are. You have several options. There's going to be hormonal therapies, there's going to be surgical treatments, and there's also some emerging and experimental treatments that we don't know a lot about yet, but they could be promising in the future. And of course, as always, there's things that we could do for our lifestyle, that we can make changes ourselves, that maybe with a clinical treatment, we can also do at home to maybe create a better future for you and your pelvic health. And of course, because endometriosis does affect your fertility, there are some fertility treatments that we're going to talk about as well. First, hormonal therapies. What these hormonal therapies aim to do is to either reduce or eliminate menstruation, because obviously a lot of the problems that surround endometriosis do come from the period itself. So hopefully what they're doing with this is to kind of slow down that growth of your endometrial tissue and reduce symptoms by affecting your hormone levels with essentially pharmaceuticals. The first one being those oral contraceptives or birth control pills. We all know that birth control pills can stop your menstruation or quote unquote regulate it, kind of put you on a cycle. Side effects could be nausea, weight gain, breast tenderness, mood changes, of course, increased risk of blood clots. They don't really tell you that one, but we always want to go over it, especially if you are a smoker or over the age of 35. So there's the birth control pills. Then there's progestin-only treatments. These could come in the form of pills, intrauterine, or IUDs like the Mirena, or injections like Depo-Provera. While the birth control pills, they combine estrogen and progestin, these don't have any estrogen. It's just progestin, and it's going to reduce those estrogen levels, because remember, estrogen can be a culprit in endometriosis. And when they reduce the estrogen levels, that's going to help thin out that endometrial lining and help to reduce any sort of endometriosis lesions. Some side effects that you could get from progestin only is irregular bleeding, weight gain, mood swings, decreased bone density, especially if you have a long-term use of injections. And decreased bone density can be a little scary because it just means your bones aren't as strong over time, and it could lead to things like fractures or osteoporosis when you're older, right? So if you have a fall when you're older, you're going to be more likely to break your hip or a bone or some sort of thing that really helps with your body structure. Another hormonal therapy, which is going to be a really interesting one, is the GnRH agonists or antagonists. These are drugs that are going to suppress the ovaries from producing hormones, inducing a temporary menopause-like state. So in order to try to help your body with the endometriosis that it's dealing with, it's going to completely suppress all hormones that are functioning and make your body think that it's going into menopause. Because naturally, when we go into menopause, our endometrial lining gets thinner anyway because our body is not producing those hormones that's helping it grow. So they're hoping to treat endometriosis by just completely suppressing the hormones and kind of throwing your body into a menopause-like state through drugs. So of course, because you're going to be in a menopause-like state, side effects will include pretty much menopausal side effects like hot flashes, night sweats, vaginal dryness, mood changes, decreased bone density as well. And because of that, a potential for more long-term bone health risks. And finally, another hormonal therapy that they offer is aromatase inhibitors. Aromatase is an enzyme that converts androgens to estrogen. So remember, androgens are more of like the male sex hormones, and aromatase is what converts that to estrogen. So when you take an aromatase inhibitor, it's going to inhibit or kind of slow down or stop that aromatase. So instead of turning the androgens to estrogen, it's going to not do that, and as a result, lower your estrogen levels. Some side effects that come from this are going to be joint pain, bone loss, hot flashes, fatigue, and some GI disturbances. There's some non-hormone treatments that they offer. First one being NSAIDs. So we know some NSAIDs such as ibuprofen, naproxen. So NSAIDs are technically pills, over-the-counter pills that you can buy pretty much anywhere, and they're going to work to help you not really treat endometriosis, but help with its symptoms because it's going to help reduce inflammation and as well as reduce some of that pain that is often associated with endometriosis. I know most of us already take some form of NSAIDs when we, have a headache, have period cramps, or just any sort of unpleasant pain that we're dealing with. Usually they don't come with side effects, but if you're using them over a long period of time, it could cause your GI system to be upset. It can lead to ulcers, which are essentially little wounds in the lining of your stomach, in the lining of your GI, because sometimes these drugs, if you're using them a lot or using them on an empty stomach, they can burn little holes in the tissue. It can also lead to kidney problems or an increased risk of cardiovascular events with long-term use. So even though these painkillers, over-the-counter painkillers, ibuprofens, NSAIDs, they can be helpful, we just don't really want to overdo it because with all these side effects, it can really lead to a lot more unpleasant things. When it comes to chronic pain that comes with endometriosis, there are things that your doctor can prescribe you like neuromodulators. You might have heard of things like gabapentin or amitriptyline. Those are going to be what they use for chronic pain, but you got to be careful using them because their side effects could make you feel very drowsy, dizzy, give you a dry mouth, lead to potential weight gain. So just be careful if you are having to use those. Of course, there are going to be surgical treatments for endometriosis. First and foremost, laparoscopic surgery. We talked about it a little bit earlier, but laparoscopy is going to be that minimally invasive surgery. It's used to either remove or destroy that endometrial tissue and adhesions. They consider this as an option when symptoms are pretty severe or when the patient is very concerned about their fertility, which I don't necessarily agree with personally, because why wait for it to get that bad to do something about it? I came across a TikTok video of the singer Halsey talking about how I think she went and got her endometriosis treated and those implants removed, like I think at the age of, I don't know, but she was very young. You'll have to look it up. But literally that next month, she got pregnant on her own. And yes, that was like a really amazing story. If you're interested, go on TikTok and look it up. Some side effects of that laparoscopic surgery could be, obviously, with any surgery, infection, bleeding, damage to nearby organs, and unfortunately, recurrence of endometriosis. So it's not necessarily a promise that it's going to get rid of it forever. And recovery could involve pain, temporary fatigue, as with pretty much any surgery. The next one, it's a little bit more severe. The other surgical treatment that they have is a hysterectomy. A hysterectomy is pretty much a partial or a complete removal of the whole uterus outside of your body. They're going to go in, take it out. In the cases of very severe endometriosis, that removal of the uterus, hysterectomy, and honestly, sometimes the ovaries might be considered. It's like, hey, nothing else is going to work. This is what we're going to do. However, when you do accept a hysterectomy, you need to be aware that you're going to be permanently infertile. There could be surgical risks, and again, might not completely fix the problem. You might still have continued pain if that endometrial tissue was somewhere outside of the uterus, right? They took the uterus out, they thought they fixed the problem, but there could still be some endometrial tissue left over in the pelvis. And if the ovaries are removed, if that's part of the surgery as well, patients are just going to immediately go into menopause because their ovaries are no longer in their body producing those hormones that they need. So there's some newer and kind of experimental treatments that might be on the horizon that could be available for endometriosis patients either now or in the future. Some of these could include something called SPRMs, and it stands for selective progesterone receptor modulators. This is also a mouthful. So how SPRMs work is by modulating the effects of progesterone, which is a hormone that women experience more in their luteal phase or after ovulation. But SPRMs, by working on progesterone, they aim to reduce endometrial growth and the pain that comes with it. The side effects for the SPRMs are still under study, but some potential side effects could include menstrual changes, headaches, as well as hot flashes. The next one is immune modulation therapies. Since we know that the immune system can have a lot to do with some women's experience with endometriosis, these modulation therapies are going to be able to target the immune system to kind of do its job better so that it can reduce inflammation and also those abnormal immune responses that can sometimes be associated with endometriosis. Now, the side effects can kind of vary, so depending on a specific therapy, but it could include increased infection risk and autoimmune complications. The next one that they're currently working on is gene therapy and molecular targeted therapies. These therapies are still currently in the early stages of development, but they aim to address those underlying genetic causes, right? Those molecular pathways that are involved in endometriosis. Things that are part of the gene code that we can't necessarily see, right, when we open up the patients. The side effects for that still pretty largely unknown because the research is still ongoing. Finally, one that could be a little controversial is CBD and medical cannabis. Cannabinoids, which is the component of THC and CBD, is being explored for its potential to manage the chronic pain as well as inflammation associated with endometriosis. Remember how we talked about when they use NSAIDs, right? Things like ibuprofen and things like that. And if you use them for a really long period of time, and over time, they can really create some adverse side effects like those holes and ulcers and potentially an upset GI system, as well as something as terrifying as cardiovascular issues, right? So we do know that cannabinoids can have a similar effect where they can help with pain and inflammation, but maybe not take as much of a toll on the body. However, some side effects of CBD and medical cannabis could be drowsiness, dry mouth, changes to the appetite, as well as potential for psychoactive effects depending on the formulation. But as a whole, when used for endometriosis, this can be really helpful. When it comes to lifestyle and complementary therapies, so complementary means things that you do in addition to medical therapies to kind of help get you your desired effect, help treat your condition, and just kind of boost it in addition to what you're getting done medically. For diet and nutrition, it can work because dietary changes, increasing omega-3 fatty acids, right? We talked about that a little earlier, and reducing red meat and trans fats can help manage the symptoms. Why? Because those types of changes, they will affect the estrogen in your body, which will then affect the severity of endometriosis that you're experiencing. With the side effects for diet and nutrition, it's pretty much generally safe, but you just want to steer away from creating drastic dietary changes. Anything like this should still be done under professional guidance, like of a clinical nutritionist or nutrition and dietetics counselor, in order to ensure that your nutritional needs are still met and that you're still getting everything that you need and not cutting out really important nutrients. Next is physical therapy and exercise. We do know that pelvic floor physical therapy, as well as regular exercise for the patient, can really help manage their pain and improve their quality of life, because endometriosis patients are very commonly experiencing pain during intercourse. Some of that pelvic floor physical therapy can be a huge help to people who are experiencing that. Side effects, of course, again, are minimal, but again, if you do anything improperly or do improper exercise techniques or aggressive physical therapy, that could actually exacerbate the pain. So you just want to do this gently just to kind of help your body deal with what's going on. Another one is going to be acupuncture and herbal medicine. These complementary therapies are used by some women to manage pain and improve well-being. Obviously, that's not really something that's at the top of the list because this isn't something that Western medicine uses. It's more of a Eastern medicine, Chinese herbal medicine type of vibe. Just something to keep in mind, and this is just kind of based on your own personal experience. If it works for you, great. If it doesn't work for you, that's also okay. Some side effects could be that acupuncture does carry a little bit of a low risk of infection or injury. Not a lot though, but herbal medicines, because herbs are very, very strong, they can actually interact with other treatments. So it should be used cautiously, and you should always let your doctor know that you're going on some sort of herbal supplementation or something, because then they'll be able to counsel you and make sure that it doesn't have any weird interactions with your medicines. That's going to be about it for lifestyle and complementary therapies. Next, we're going to talk about fertility treatments, because we know that about 40% of infertility patients are coming in with endometriosis. The main thing that is used to help these patients conceive and have their children is IVF, or in vitro fertilization. It can be a really successful option. It's where they harvest the eggs from your ovaries and combine them with sperm outside of the body and then implant that into the body, because remember that sometimes there can be some fluid in the fallopian tube, and due to the amount of endometrial tissue or perhaps some adhesions and things like that, your body can have a hard time getting pregnant on its own, kind of transporting that egg through the fallopian tube and into the uterine cavity. Some side effects are that the risks could include ovarian hyperstimulation syndrome, because they give you drugs to stimulate the ovaries to produce eggs, right? So if you kind of go through that a lot and do a lot of that, then it could lead to that syndrome of the ovaries. You could also end up with multiple pregnancies. I know that a lot of people, in order to increase their chances with IVF, will opt for multiple embryos. And of course, there's always the emotional and financial stress of the process. That's it for endometriosis treatments. Next, we're going to talk about what is the future outlook or the prognosis for women with endometriosis. What is their life going to look like after they've been diagnosed with this condition? Well, I'm not going to sugarcoat it. This disease does have a chronic nature. What does chronic mean? It means ongoing for a long period of time. You can try to help it, but it doesn't really ever go away. While these treatments that we talked about can help manage those symptoms as well as improve the patient's quality of life, unfortunately, very sadly, there is no definitive cure. A lot of these women, they'll experience symptom recurrence. The symptoms, even though they try to do all these things, the symptoms might be coming back over time. And especially if they stop treatment. The thing is, too, with how invasive and stressful surgery is, endometriosis coming back after surgery can be significant, with estimates being from like 20 to 40% within 5 years after that surgery. So that's just something that, like, I don't know, it makes my heart hurt for these endometriosis girls. And just the fact that you can really try to do everything under the sun, but we just still have not found a definitive cure. The impact on their daily life can also be very taxing, such as chronic pain, fatigue, and other symptoms that are very unpleasant and can affect their daily activities, their work, their social life. Many women learn to manage their symptoms over time, but again, it often requires continuing with those ongoing treatments and lifestyle adjustments. When it comes to their fertility, there is a big impact on fertility because endometriosis is one of the leading causes of infertility. It will affect 30 to 50% of women with the condition. So that's how many women who have endometriosis will also struggle with infertility. This disease, it can cause scarring within the pelvis, blockages, damage to reproductive organs, which again kind of gets in the way of your body naturally conceiving and kind of keeping things moving inside the pelvis. But not all is lost, because many women with endometriosis are still able to somehow conceive naturally. Some of them might require those fertility treatments such as IVF. And it all depends on every single person. Success with those fertility treatments might vary, and some women, again, might achieve successful pregnancies with or without medical intervention. As always, the early diagnosis and early treatment can really improve those outcomes. Let's talk a little bit about the mental and emotional health. The psychological impact is also huge because the chronic pain that these women experience, as well as the potential of the impact on their fertility that's associated with this disease of endometriosis, it can really lead to mental health challenges like anxiety, depression, and stress. And while I'm not an authority to speak on mental health, I do know that this emotional burden that living with a chronic condition, it can also just make girls feel really isolated and frustrated, which is why it's really important to look for long-term psychological support, counseling, and kind of getting yourself involved with support groups, maybe people who are also going through this and dealing with this, because it can really improve the mental health for these patients and women with endometriosis. When it comes to managing endometriosis long-term, don't forget that it's an ongoing treatment. A lot of these women are going to require treatment potentially until they get to menopause in order to help manage their symptoms. It can include constant hormonal therapy, some pain management strategies, as well as regular monitoring of the condition. And what's really sad is that some of these women might find themselves undergoing multiple surgeries over their lifetime just due to the recurrence percentage. The thing that can really, really help, of course, is altering your diet, your exercise, how you manage stress, and those alternative therapies like acupuncture and Chinese herbal medicine. Those will be crucial in long-term symptom management. These endometriosis patients' quality of life can vary significantly. Some women might manage their symptoms really, really well with treatment and continue to maintain a high quality of life, while others, it might be more of a struggle with them because of the persistent pain, maybe struggles with infertility, as well as other challenges. But again, we live in the era of information and connection with other people, so you could really find some empowerment through education about this condition and proactive management, because it'll just make you feel empowered to take control of your health and let you know that it'll lead to better long-term outcomes. There are a few potential complications that endometriosis could lead to. Some women who deal with endometriosis might develop chronic pain syndromes, such as pelvic floor dysfunction or central sensitization, which can kind of complicate their long-term management. There's also a higher potential for risk to develop other more serious conditions. The research that they've done towards endometriosis can suggest that women with endometriosis might be have a slightly more increased risk to develop other really unfortunate conditions, such as certain types of ovarian cancer or autoimmune diseases. However, on the bright side, the risk is pretty generally low. I do want to leave us off on a better note because there is hope for the future. We have this increased awareness about this condition now. We have better diagnostic tools, as well as people pouring money, time, and effort into ongoing research, into new treatments. Although all of this stuff can be like some really heavy information to swallow, overall, the long-term outlook for women with endometriosis, it is improving. Again, a reminder that the earlier you get diagnosed with it and the more comprehensive the management of your symptoms is, these are going to be key to achieving the best possible outcomes. To conclude this episode, we delved pretty deep into the topic of endometriosis, which is a common yet often misunderstood and misdiagnosed condition that affects many, many women, 190 million worldwide. We covered the definition and symptoms of endometriosis. So endometriosis, again, is when the endometrial tissue that's only supposed to be inside the uterine cavity starts implanting and finding a home on the other pelvic organs, such as the fallopian tubes, the ovaries, the bladder sometimes the rectum. This can lead to really unpleasant conditions. First of all, affecting the period, affecting your sensations when you're having intercourse. It could affect your pelvic floor and then lead to other more unpleasant things like GI and urinary symptoms. We also know that there are different ways that endometriosis gets diagnosed, with that laparoscopy, little surgical camera kind of being the best way to diagnose it. We also went into the various treatment options, all the way from hormonal therapies like birth control pills, to surgical interventions, to lifestyle modifications like diet and exercise, to fertility treatments like IVF. We also talked about some of the newer and experimental treatments, like those immune modulation therapies, things that are aimed to help your hormones and your immune system deal with endometriosis a little bit better. Of course, we covered the impact that endometriosis has on fertility and the available fertility treatments, and also how much this can impact a woman's self-esteem and mental health. Finally, we talked about what is the long-term outlook and the quality of life for women with endometriosis. Today, we talked about the chronic nature of endometriosis and the importance of managing it kind of as an ongoing treatment your whole life. although it's really sad that there's no definitive cure, we talked about how important it is to get an early diagnosis, to get comprehensive treatment, and of course, to find a supportive network, because that can significantly improve how endometriosis can impact your life. Remember, if you have endometriosis or if you think you might, it's very crucial to always talk with a doctor to get you the proper diagnosis, the proper treatment. And if you do look for alternative therapies like acupuncture and herbal medicine, to always inform your doctors so that they can make sure there's no adverse interactions between your medications. So yeah, this episode was a lot, but thank you for bearing with me. We'll see you guys in the next one about ovarian cysts or PID. I'm not sure yet which one we're going to do, but be sure to follow along on Instagram at Stellar Cycles Pod. Please give us a 5-star rating or leave a review if you're feeling extra generous today. Until next time, Stellar Cycles out.